Welcome to episode 178 of the Forward from 50 podcast, where we interview people over 50 who are pursuing new direction for their lives. It's an opportunity for men and women to tell their stories, their way, and in their own words. I'm Greg Gerber, the founder of Forward from 50, and your host for today's show. Today's guest is Mark LaMaster. He is a registered nurse with nearly 3 decades of experience helping others to improve their health. But after turning 50, Mark unexpectedly found himself sitting on the other side of the exam room. His physician delivered a wake-up call that forced Mark to confront his own health before it was too late. In this episode, you'll discover several important takeaways. First, Mark explains why treating symptoms isn't always enough and why understanding the root causes of poor health can make all the difference. Second, he shares how simple lifestyle changes, including intermittent fasting and healthier food choices, helped him to lose 45 pounds in 90 days while dramatically improving his energy and overall well-being. Third, you'll hear why Mark believes that turning 50 isn't the beginning of the end. Instead, it's the perfect time to reclaim your health so you can enjoy the adventures, travel, and family experiences you've been dreaming about. Finally, Mark offers hope that many chronic health conditions can be improved or even reversed through education, better nutrition, and sustainable lifestyle changes. If you've ever wondered whether it's too late to improve your health, this conversation may change the way you think about your future. To tell us more, please welcome Mark LaMaster to the show. Thanks for joining me today, Mark. I really appreciate it. Now, you've been an RN for, about 30 years, but you became a patient yourself a couple of years ago, and you didn't expect that. Tell us what happened.
Yeah, so like you said, I've been a nurse for darn near 30 years, and I've been helping people get healthy and stay healthy for the entire time, whether it's emergency nursing, flight nursing, clinic nursing. Now I'm doing some documentation integrity stuff. So I've been doing a lot of different things in healthcare. And not too long ago, I was sitting across from the doctor in the doctor's office, and he said, "Mark, if you don't do something pretty drastically here, you're going to have a hard time seeing those grandkids a year someday that we've talked about." Now, I've had this doctor for 20-something years, which is not very normal in today's day and age. So we developed a really good relationship, and he was just brutally honest with me. And it was really a gut punch to me. I couldn't believe that I was hearing my doctor tell me the things that I've been trying to help people with their whole life. I became the patient, and it truly made me make some big decisions in my health.
I can imagine. That is something that many seasoned citizens find out way too late in life, that they are always putting off to someday what they're going to do with their lives. Then when someday finally arrives, they don't have the strength or the health to enjoy it.
Yeah, I tell you what, from that moment though, when I heard that, I was sick at the time, so I really decided that I needed to make the change, but I wasn't in the right space to do it because I was still sick. And so what I decided to do was I decided to research. I have my master's in nursing, so I did a lot of research to get that degree, and I just went after it. So I started looking everywhere. What can I do to make myself feel better? I thought I knew what was wrong with me, and I discovered metabolic dysfunction and insulin resistance. 2 things that I knew about the basics, but not in depth. And that was the root cause of everything that was going on with me. So I learned about that, and I learned, how do I change this? How do I transform my life step by step, but really getting after the root cause instead of treating the symptoms that I normally would have thought about in the past. So that's what I did.
That's good. That's a problem with the medical profession today, is they are so busy that they often just treat the symptoms without diving into the root cause. You were able to find information on your own, though? That was pretty ingenious.
Yeah. So what I found was, and I think this has really happened, I think people in general are just more in tune with what's happening ever since COVID, right? We started questioning some things. And so what I did was I found that really the root cause is the insulin resistance that's been building up over probably the past 10 or 15 years in my body. And I realized that because of my diet, the highly processed foods, the way that I was eating, sometimes I'd be eating 5 or 6 times a day. Not a full meal, but I'd have breakfast, then I'd have a snack because I was getting tired in the morning. So I'd eat that bagel or the donut that they brought to the office for snacks for a special treat. And then I'd eat lunch. And then by about 2 or 3 in the afternoon, I started kind of crashing again. And then I'd have another snack, and then it's time for dinner. And then it's time for, hey, let's watch a movie or some Netflix and popcorn, M&Ms. And so it was just kind of constantly putting food in my mouth. And what I realized is that I wasn't giving my body a chance to kind of switch the fuel sources. So my insulin level was super high, and so was my glucose levels in my bloodstream. So in order to help my body start burning fat, I needed to lower my insulin levels. And because a phrase that I've come to know really well is that if the insulin is low, the fat's got to go. So what I found was a program that combined intermittent fasting, better healthy choices of food, and not healthy in the traditional FDA recommendation stance, but just really whole foods and real food, not the highly processed stuff. And then I supplement it with a product from Unicity called the Field Rate System. That was the backbone of what I used. And I tell you what, it has been almost to the day, 90 days since I started that plan. And I have now lost 45 pounds in 90 days. My blood pressure's normalized. I'm actually looking forward to getting my labs drawn next week, which is something I could never say that I've said in my life, in my entire life. I really don't want to go get a blood stick, even though I've stuck probably hundreds of people with the needles. But I'm looking forward to those lab values because I know that I have transformed in those 90 days. I'm a new person. I have more energy. And I just want to give people hope that there is a way to change where you're at if you feel stuck. And as a nurse, that's part of who I am. I've been ingrained as helping people my entire career. And now I'm doing it for myself, and I want to help others again. So it's been quite the transformation.
That's good because we need it. I know that's a problem for me. My weight has been going up and down for years. When I try and control it and try and eat healthy, that's when your well-meaning friends step in and say, oh, you got to treat yourself something. You can't be all diet all the time. And that's wrong. If you have a good diet of good quality foods, you can do that forever without having the cheesecake and things like that.
Yeah. And I definitely think there's room for, hey, this is a time to celebrate. Instead of having 5 pieces of cake, maybe having 1. I'm saying that because I've done that. I recently went to an event where they had this cake. It was so good. And I literally had 5 pieces. This is before I started all this. I had 5 pieces of cake and I could have eaten more. So the next time I went to a party or an event, I literally had 1 piece and I just said, I didn't feel like I needed any more, but it was a conscious decision not to have that extra piece or those extra pieces. I can eat, and it's not our fault that I think we're hungry all the time. I think it's just the way that our culture conditions us to eat the Kellogg's breakfast. That's the most important meal of the day, even though it really isn't. That's where I actually fast. I do not eat breakfast now. I fast after my evening meal. So I have about 16 to 18 hours of fasting per day. And I have about a 6 to 8 hour eating window. And I have more energy than I ever have following that kind of an intermittent fasting plan.
That's great. My weakness is pizza. And I have found that in the past, I could easily eat half a 16-inch pizza by myself. And I really have to limit myself when I want to do that treat to 1 slice. And it's hard, but I can do it.
Greg, we're in the same boat, man. Pizza is my kryptonite. Pizza and peanut M&Ms. But I can one-up you on this one because I could eat a whole pizza. That's how much I like the stuff.
Mm-hmm. That's right.
Oh yeah, I could definitely in the past eat a whole pizza. Now, I don't even have the cravings to eat the whole thing. I still crave pizza, but I don't have a cravings to just shovel down a whole pizza.
And when I've had a couple of slices instead of 1, my body reacts now and says, wait a minute, what are you doing to me? and I just don't feel good. I feel bloated and, like you had said before, tired all the time. And I think a lot of people today are tired all the time. How much of that is related to diet?
I would say way more than you think. So here's a statistic for you. 93% of Americans are metabolically unhealthy. So you're talking 9 plus out of 10 people. And you see it in the grocery store. You see it at the mall.
At the beach.
You see it at your family reunion. Yeah. And it's significant. So I would say that, I'm not going to give a percentage, but I would say that the majority of our issues stem from our diet and our diet practices. Because if you go to the grocery store today, the majority of the food comes from the same 5 to 10 ingredients. It's highly processed wheat, highly processed corn, fructose, high fructose corn syrup, a bunch of different things that are all coming really from the same place. They're just packaged in pretty colors, different packages. But the reality, it's all really the same kind of food. And we eat a lot of it. And we crave a lot of it because it's designed scientifically and chemically designed for us to want it and want more and to crave it. So I would say that the majority of our health issues are related to the food that we eat.
I would agree with that. Absolutely. I know that has been the case for me for many years. But where can people find more information about things that they should be doing? You go in to see a doctor and the doctor says, eat less and exercise. That's the basic standard routine that you're given almost every doctor appointment. But you have to go beyond that to find out this information. So what can people do to take control of their health in that regard?
Yeah, it's a great point and a great question, because if you go back to what you said earlier, doctors don't have time. So in the world that I live in, I see it every day. Providers are asked to see more and more patients and spend less and less time with them. So what they really do, what they have time to do is they follow a protocol. They follow, if your blood pressure is this, then you do this. If your glucose is this, you do this. So it's very standardized. It's designed that way because they need to be quick. They can see what it is and they can treat the symptoms. But you're right. They're not getting at the core. The core, when you end up with a severe enough disease progression, you end up in the hospital. So they temporarily fix you in the hospital with some amazing physicians and nurses and teams that can use some very powerful drugs and do different things to keep you alive, if you will. But then most people just go back to the same kind of lifestyle patterns and behaviors. So one of the things that I would say to look up is just to Google metabolic dysfunction or insulin resistance. And a couple different books that I would recommend. Dr. Fung, he's out of Canada. He has a book called The Obesity Code, and he also has a book called The Diabetes Code. So those two are excellent resources. The other book is called by Dr. Ben Bickman, and he is a PhD scientist out of, I believe it's BYU. And he has a book called Why We Get Sick. There's several books that have that title, so make sure it's Dr. Ben Bickman. That is a book. I'm a book guy. I know there's different ways to get that information. If you want to look up Dr. Ben Bickman or if you want to look up Dr. Jason Fung, I said those are two of the ones that kind of had a big impact on me. And they really just talk about why insulin and blood glucose are really the cause of all of our issues. It's not just diabetes. It's everything that you see. So are you okay if I give you a few different symptoms of what insulin resistance can do to your body, or people that have it, the symptoms? So the first thing is the bloating that you're talking about. The second thing, or another thing, is it leads to cardiac disease and cardiac death. So 1 to 2 out of 3 Americans have cardiovascular disease. And we see that especially in age 65 and older. You're also talking about anything from postmenopausal symptoms, is something called PCOS. It's called polycystic ovarian syndrome that causes infertility in women. So there's a lot of women that have insulin resistance that can't get pregnant because of this PCOS. I think they just named it PMOS. If you've ever heard of fatty liver, that's a main cause. Insulin resistance is a main cause of fatty liver disease. High blood pressure, diabetes type 3, which is being called in a lot of different countries besides the US, which is Alzheimer's. The list goes on and on. A lot of GI symptoms, so irritable bowel syndrome, ulcerative colitis, a lot of the autoimmune diseases. So this chronic inflammation caused by insulin resistance shows up in a lot of different things. And so once you know the root cause, we can start saying, okay, what am I doing wrong with my diet? How do I change that up? How do I change how and when I eat? And then you can start really getting after the symptoms, because you're going after the root cause.
I understand you developed the LaMaster plan that is going to help people, especially busy adults over 40, to better understand their metabolic dysfunction, insulin resistance, and lifestyle factors that can impact their health. How are you going to be working with people? Are you going to start coaching them?
Yeah, so really what I'm doing is I'm trying to spread the word about metabolic dysfunction and insulin resistance. They go hand in hand. And so what I want to do is really spread the word. As a nurse, I want people to understand that it's not just the orange bottles that need to fill your cabinets. The older we get, the longer we live, the more pill bottles we have in our bathroom cabinet or kitchen cabinet, right?
Yep.
So I just want to spread the word that there's a way that you can live a lifestyle that you don't have to be like that. The other thing is that there's different chronic diseases that I've learned my whole entire career that I thought they were chronic and they were irreversible. But I've now learned that even type 2 diabetes can be reversed. Fatty liver can be reversed. These long-term chronic diseases can be reversed. And there's a lot of people struggling out there that just say, oh, I'm going to be on insulin the rest of my life. Or I'm going to be on lisinopril, hydrochlorothiazide, or HCTZ, metoprolol, you name it. I'm going to be on that the rest of my life. And you just take it. So what I want to do is I want to spread the word and be that resource to help people understand that, say, hey, you know what? I've got these symptoms. I want to live in my 50s and beyond like I was and I believe that's possible. I believe that we can change the health of our country, and by doing education, teaching, coaching, and by just really trying to educate people on something that's disruptive to the medical world. It's out there. It's just not standard in America right now.
So that's what you're going to be doing, is you're going to be identifying people who know they need to change, and then you're going to help guide them into the changes that they need to be made.
Yes, okay. That's exactly right. And in my past, I've done some coaching. We've written a few books together, or not together, but in the past, we've written books and authored books on different things. And so I feel like, and I also have my master's of nursing and education. So I feel like there's an education component to this, that if I can help educate people and they can educate somebody else, there's that trickle down effect.
That's right.
Because I really want, and that's what I love about your audience, is that at 50, I think we're just getting started. I think we're just coming into our own and realizing what we can really do, what our true potential is. And that's what excites me about being on here and sharing this with your audience, because we can do some amazing things. We don't have to all of a sudden decide, oh, we're almost 60 and we're almost going to retire. We're almost going to get to retirement. We just got about 8 more years. Let's enjoy that. Let's embrace that, and let's live out our dreams. And I think we can, but we have to be healthy to do that.
I agree. And if you're educating others, the trickle-down effect is immense, especially if you can get parents to get behind the program and then turn around and convey that same sense of healthiness and healthy living to their children and grandchildren.
I completely agree. And I know that if you can, I'll just give an example. So I started doing this, like I said, about 90 days ago, and almost exactly within about 3 weeks, when I started with the intermittent fasting and the Feel Great system that I talked about, my wife, she goes, I know you're losing a little bit of weight, but she goes, I can really tell that your mood's improved. I can tell that you have more zip, more energy. You're not taking as many naps. And that was within 3 weeks.
Wow.
So this program, the way that it works is that you can literally start to see changes in just a couple weeks. And one of the biggest things with that insulin resistance is that there is visceral fat. That's the fat that's in your belly, that's around your organs. And when you start doing the intermittent fasting, and when you start really focusing on getting healthier and eating at the right times, the body starts burning that visceral fat first. And that's the most dangerous fat that we have in our body because it starts suffocating the organs inside. So that gets attacked first, which is perfect, right? Because that's what we want to go after first anyway. So that is the whole thing where my wife saw it, so she started doing it. And now doesn't have her hot flashes anymore. She sleeps better at night from her postmenopausal symptoms that she was having. And then she tells a friend, and I have family that sees me, and it just keeps building. And my hope is that somebody, even if it's one person in your audience, says, hey, I can do that. I know that there's a way to get healthier, and maybe that one person spreads it to other people. So that's what's awesome about this opportunity. So thank you.
Is it true that you and your wife are considering starting an RV tour to go out and get this message shared on the road?
Yes, it is. I'm so glad you asked. So the whole RV thing, I think for my wife, and I think it's an empty nest thing. So both of our kids have flown the nest, or they're out of the house. I've got a daughter that just graduated, and she's going to take a job in Denver, Colorado. She starts here in just a few months. And then my son is a airborne trooper. He's a combat medic in the Army. He's down at Fort Bragg in North Carolina. So they're going to be on 2 different time zones, right? And so we're like, how are we going to see them? But the initial plan, I think we're on plan F4 now, because it's changed so many times. But we'd like to hit as many national parks as we can. And we want to see the countryside while we're young. We don't want to be 67 or 69. That's older, but we want to be like, let's roll, let's do this, because we want to do it as soon as we can, and because we want to enjoy it and we want to be able to see our kids. But the problem is that we're not the savviest RVers. So we have lots to learn. So I'll probably be reading a lot of your articles that you wrote in the past, and maybe even reaching out to you.
Very cool. I know that's important because a lot of people, like I said before, plan to do that kind of travel, etc., after they retire. And then because they have not taken care of themselves and they've neglected their health, they get to that age where they are retired and they are in the RV, but they only have the energy to pull the unit into the campsite and roll out the awning, and that's it. Just sit there without exploring the area that they came to visit. So doing this when you're young is absolutely beneficial, and I know you're going to have a lot of fun doing that. And what kind of RV do you have?
We have a Grand Design Imagine. And I'm thinking of you'll know exactly what it is, won't you? I think it's an RLS.
Okay.
So it has a rear
living.
Yep. And I think it's 34 feet. So the funny thing is, Greg, is that we started with a truck camper. That was plan A. And you've met me. And especially when we had it, I'm a big dude. I was a lot bigger then, but it just was a little bit too small for what we wanted to do. We took it out a few times and we felt like we were crawling over each other more than we were like enjoying kicking back. And this thing that we have now, this Grand Design Imagine, has couple couches in it. It's got a queen size bed. It's got a full kitchen. It's glamping.
Okay.
So
couple of zones so you don't have to live on top of each other, and that'll help your marriage, believe it or not.
I will take that as sage advice from an expert.
I understand you created a quiz that can help people determine what their metabolic struggle is like. Tell us about that.
Yeah. So what I did was, I think everybody's got a different kind of issue with a different kind of struggle, if you will, when it comes to insulin resistance and that metabolic. It's like a metabolic leak. And that forms in, is it that afternoon crash? Is it that 2 p.m. afternoon crash? Or is it the big belly that I just can't get rid of no matter what I try and do? I exercise, I go to the gym, I run, I'm active, but I just cannot lose weight. Or is it the high performer that has literally tried every single thing out there, every single supplement, every single diet, and still they can't find a way to get where they want to be? So what I did was I created several questions that help point to that. And then I give that like a quiz. There's four different types that it comes up with based on your answers. And it's just a fun way just to ask people questions to make them think, where am I at? How do I respond to this? What are my biggest issues? And so that's been a fun thing that I created. And I like to be creative. I like to have fun. And I think that's my educational background, because I think people are more engaged when there's some fun involved. It's not just all these technical and nursey and medical words. It's what's happening in real life? What's happening to me? Why do I feel like this? And how do I get better? What is that path forward? How do I get there?
How can people access this quiz? Or the
LaMaster plan? Perfect. I think the best thing for right now is to find me on Facebook, and I'm going to have you just comment forward from 50. So I'm going to have you just go to my Facebook, Mark LaMaster, and just type in forward, and I will send you the link and to the quiz, and you can take it from there.
We'll be sure to hot link that in the show notes so that people can find it easily.
Awesome.
Yeah. I think you're on the right path, Mark. I think a lot of people know that they need help, but they don't know what to do, and they're not getting it really from their doctors because the doctors really don't have time to educate them. So if you can do that to help people develop a desire for a stronger, better, healthier lifestyle, I think that's going to bode well for you in the future. I thank you for sharing your story.
Awesome. This has been an awesome opportunity. And I can only imagine, with all of the interviews that you've done, how inspiring it can be to hear what we can do after 50.
Absolutely.
And I got sick when I was 50, and now I'm 51. But I feel like I've had a great life, but I feel like the best part of it is in front of me. And I can't tell you how that feels, because if I would have been on the same path that I was going, it wouldn't have looked like that. So what you do is inspiring people. And I just want to thank you for that, for all the stuff that you're doing. So thank you so much.
My pleasure. Mark LaMaster's story reminds us that sometimes life's greatest turning points begin with difficult news. Rather than accepting declining health as inevitable, Mark chose to educate himself, make significant lifestyle changes, and create a new mission centered on helping others to do the same. Today, what gives Mark meaning and purpose is combining his years of nursing experience with his passion for teaching. He wants to help busy adults to understand metabolic health, identify the root causes behind many chronic conditions, and to equip them with practical tools to build healthier lives. Mark's goal is to help people enjoy their 50s, 60s, and beyond with the energy to pursue their dreams instead of watching from the sidelines. If you'd like to connect with Mark, find him on Facebook by searching for Mark LaMaster. As he mentioned during our conversation, simply comment with the word forward on one of his posts, and he'll send you a link to his metabolic health quiz and information about the LaMaster plan. That's all for this week's show. If you'd like to start living a more meaningful life, I encourage you to download our free guide to finding purpose, which is available at www.forwardfrom50.com. I'll have another inspirational interview on the next episode of the Forward from 50 podcast. Thanks for listening, and if you like this show, please consider leaving a review wherever you download the episodes.